My name is Lily, the Agency Training Coordinator, and today we have Lupe Conchas here with us from Bread for the World and our own Public Policy Manager, Ashley St. Thomas. They're both speaking with us today about the COVID and federal nutrition policies. So I'll go ahead and hand it off to them.
Hi, everybody. I'm Ashley St. Thomas. I'm the Public Policy Manager with the Arizona Food Bank Network. I think you can go to the next slide, Lily. And I'm really excited to be here and talk to you about some changes with federal nutrition programs that we've seen during the pandemic and ones that we want to see continue into the future. Next slide. So just a little bit about us. You probably already know this, but the Arizona Food Bank Network is a coalition of 5 large member food banks throughout the state. And we work with about 1,000 partner agencies to get food to people in need all throughout the state in all 15 counties. And that's what we do to meet the immediate need, the urgent need for food. But we're also looking for longer term solutions to end hunger. And that's where public policy and innovative programs come in. Next slide. So looking at food insecurity overall in Arizona, obviously there's been a huge spike in that in the need for emergency food assistance during the pandemic. And this slide just gives a really brief overview of pre-pandemic levels and in the year 2020. So you can see from this overall that Arizona has a higher food insecurity rate than the national average. But what does that really mean? Is that nearly 1.2 million Arizonans struggled with hunger in the year 2020, and roughly one in 5 kids. So what I typically say and what is true is that prior to the pandemic, our network was serving about 450 to 460,000 people each month, which in and of itself is pretty astounding. But we knew that probably double that many, or 1.2 million, were struggling with food insecurity, meaning they're living paycheck to paycheck and they're not entirely sure where their next meal is going to come from, whether it'll be affordable, whether it'll be nutritious. And unfortunately, when the pandemic hit, we saw that data really come to life. So our food banks saw double and triple as many people in line for food at the earliest months of the pandemic, and that demand has not leveled off entirely. It hasn't gone back to pre-pandemic levels, but it's come down quite a bit. So that's the demand side. And then Lily, next slide. And so this is the supply side, which, as you can also imagine, was definitely turned on its head as a result of COVID-19. So in a normal year, which we haven't seen in quite some time, this is where our food banks get their food. So about 40% of the food comes from government programs. That's USDA commodity programs like TFAP, CSFP, and trade mitigation was a program we previously had. So that's essentially the emergency food boxes that people get at food banks. 26% would come from donations from farmers in Arizona and outside of Arizona. 16% from grocery stores, or what we call retail rescue. So that's products that grocery stores and smaller stores can't sell, but that's still in good condition. They'll donate to us. And then about 2% from food drives. Excuse me. From different places, churches, corporations, schools. And during the pandemic, again, that was all flipped on its head. So we got about 70% of the food we distributed from the USDA, and much lower amounts from grocery stores and farmers because they had less to give. So how did we get all of the food that we are distributing, and how did people not go hungry during the pandemic? So next slide. At any time in a pandemic or otherwise, food banks obviously can't fight hunger alone. So we know that for every 1 meal a food bank can distribute to a family, federal nutrition programs such as SNAP can distribute up to 10. So working together as an emergency food assistance provider and a group of an anti-hunger organization that's trying to change the future of hunger in the country. That's where federal nutrition programs come in. Next slide. First and foremost, the nation's strongest and most effective anti-hunger program is the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. So there have been a lot of changes to SNAP during the pandemic, and some of them we're hopeful and grateful to see continue. So the overall benefit amount was increased by 15%, and that comes to an end on September 30th. But just for a point of reference, this graphic on the side, prior to the pandemic, it says $121 per month. That was the average nationally. In Arizona, it was about $118 per person per month, which is not a lot. It doesn't go that far. So during the pandemic and sort of outside of the issue of COVID-19, the USDA reevaluated the SNAP benefit amount because it hadn't been reassessed or changed in decades. And they found that it was woefully low and that it's going to increase starting on October 1st by 21%. So that net change for households will be an additional 6%, which isn't a lot, but overall, it's moving in the right direction. And families were also and will continue to see what are called emergency allotments. And that means that people get the maximum benefit amount per household size. So if I'm in a household with 4 people, I would get the maximum amount allowable for 4 people, regardless of my current income, regardless of my current expenses. That's still in place. In Arizona, those benefits are still being issued, and it won't end until the public health emergency declaration comes to an end at the federal level and the state level. So I think we'll definitely see that in the next month, but I'm not sure how much longer. In addition, college students became eligible for SNAP. There were work requirements around college students' participation in SNAP, which was really tricky for people who are trying to go to school and maintain good grades and keep up with life. So during the pandemic, as a result of high unemployment, college students, there were a lot of exemptions put into place so that college students could participate in SNAP. And there's a lot of information on that on our webpage if you're more interested in work with college students or are a college student. In addition, SNAP Online went national. So prior to the pandemic, only a few states had the option where people who participate in SNAP could purchase their groceries online. And during the pandemic, that went national and will be maintained nationally. So in Arizona, I believe there are 3 retailers where people can use their SNAP benefits to purchase groceries: Amazon, Walmart, and I believe Fry's, but we have more information on that on our website too. Excuse me. And then last but not least, in Arizona in particular, starting on October 1st, the standard medical deduction will go into place with the SNAP application, which essentially means that people who are over the age of 60 or living with a disability will be able to take a standard deduction for their medical expenses on their application. That gets really wonky and in the weeds, so I won't go into it, but it results in people getting more money, which is always good. So more money they can use to purchase food. So next slide. Sorry, I'm still drinking coffee at noon. So these are some of the other major changes that we saw to federal nutrition programs during the pandemic. Food boxes, there are a variety of food box programs. If you're an agency, you're already familiar with these, but they saw an increased investment for sure in food and storage and distribution capacity. All of our food banks went into contactless distribution, drive-through models. Many are still using that to curtail the spread of COVID-19. Home delivery programs are being piloted by St. Mary's Food Bank that has Maricopa County and parts of Maricopa County and parts of northern Arizona. and Community Food Bank of Southern Arizona, which is based in Tucson and operates in, I think, 5 counties in Southern Arizona. So they're doing some home delivery pilots that we hope will continue for folks who are not only quarantining or sick at home, but living with disabilities, elderly, don't have transportation to go to a food bank. And then a lot of mobile distributions took place during the pandemic, especially in tribal communities, especially in the earliest months when to curtail the spread of the disease. And then the Farmers to Families Food Boxes program was a huge source of really nutritious food all across the country. There were some hiccups in implementation, but the food itself was great. And that program came to an end in May of this year, but an additional investment from the USDA in TFAP, or the Emergency Food Assistance Program, is kind of compensating for that change. School meals, I think everybody at this point knows that free meals are available to all kids through September of 2022. Which we're really excited about and has been hugely helpful to the kids here in Arizona. And pandemic EBT, which is similar to SNAP, but not the same. It's an electronic benefit for kids who were getting free or reduced price meals in school. Helps their parents supplement those meals when their kids are at home or in different phases of hybrid learning. And that will continue through this school year into next summer. And then the Women, Infants, and Children program, which I believe my colleague Lupe is going to talk a little bit about, but that saw some changes in what people could use their benefit to purchase. And there was also an increased benefit amount for fruits and veggies, which from what I've heard from families was really, really well used. Next slide. So if you're so inclined to take action currently, and we'll have another training about sort of how a bill becomes a law and where you can get involved as a new agency, just testing the waters of advocacy. This is a place where we could use your voice. So currently, Congress is negotiating the budget, and in the large package of legislation, they're including some really great provisions to strengthen child nutrition programs, which we want to see get across the finish line. So some of those things that in particular our network supports is the expansion of summer EBT and making that program permanent. So that would be that electronic benefit that parents and guardians would get for their kids, the ones who are receiving free and reduced price meals during the school year, so that they have access to nutritious food over the summer. I can tell you, working really closely with DES and the Department of Education, that more than 750,000 kids in Arizona received summer PEBT. That just wrapped up last week. And I've spoken to more than 100 moms and dads who've just talked about how critical that benefit has been to them. So we want to see that continue permanently and be accessible to every state. Expanded community eligibility program. I won't go into the wonky details of that, but it essentially makes free meals more accessible to more kids by expanding the eligibility criteria, and it eliminates a lot of the bureaucracy and paperwork for schools. So we want to see that expansion. There would be some grants for schools to improve and update their kitchen equipment and kind of run these new healthy meal programs to improve nutrition. And then last but not least is we want to see the expanded child tax credit made permanent. I know that Lupe is going to talk about that, so I won't go into details, but I do know from some data that we've seen that sort of within the first 2 or 3 weeks of families getting that first monthly payment for the CTC, food hardship went down in households, or food insecurity went down in households by 30%. So we know that when people get this extra money, they're using it to purchase not only food, but first and foremost food, but the essentials that they need. So that cutting poverty in half certainly would help cut hunger. So we support that. And there's a link on this slide where you can go to take action, and it will just send a note to your members of Congress saying that this is what you support. And I think, next slide. Yeah, I think that is it for me. So I will turn it over to my colleague, Lupe.
Hello, everyone. Thank you so much for tuning in and listening onto this advocacy training. Bread for the World is a collective Christian voice urging our nation's decision makers to end hunger at home and abroad. And my name is Lupe Conchas, and I am the Southwest Regional Organizer for Bread for the World, and I am in Phoenix, Arizona. And you can see this picture here is when we did have in-person advocacy visits in Capitol Hill. This was one of our advocacy summits from the past years, and we were meeting with a senator's office. So next slide. So what I'm going to do today is I'm going to cover our Bread for the World advocacy agenda. And the theme for this advocacy agenda is a 1,000-day human infrastructure. We want smart investments in maternal and child nutrition and health so that our kids can thrive, can be fed, and that we can make sure that we are doing the best that we can when it comes to government interventions and food programs to help our infants and our mothers. Next slide. So the first 1,000 days, Bread for the World is calling on Congress to build a better 1,000-day human infrastructure plan in the United States. Next slide. Next slide. A comprehensive 1,000-day infrastructure encompasses quality maternal and child nutrition and health care, requires smart investments in effective policies and programs that ensure families have access to nutritious food and household necessities. So some of these programs which Ashley spoke about in this 1,000-day infrastructure is including WIC, paid and medical leave, affordable and quality childcare, and of course the child tax credit, which we're working really hard to make permanent. And we really appreciate our partners helping us to advocate for that issue. Next slide. So prenatal care. So what is the cost of limited prenatal care? About 1 in 10 babies in the United States is born prematurely each year. Women who do not receive prenatal care are 7 times more likely to have a preterm birth compared with women who attend the majority of their prenatal visits. So that's really important to understand why we need this 1,000-day human infrastructure. Next slide. So the high return on investment in maternal and childhood nutrition and health shows that, as an anti-hunger organization, Bread for the World focuses mainly on nutrition and WIC, which helps the needs of people in the 1,000-day period. Pregnant women and young children must have sufficient and nutritious foods in this time. And so the cost-benefit analysis of WIC's impact on preterm births estimates that every dollar spent on prenatal WIC yields $2.48 in long-term savings to society in medical, educational, and productivity costs. Every dollar spent on pregnant women in WIC produces anywhere from $1.92 to $4.21 in Medicaid savings for newborns and their mothers. So it's really important to understand. Next slide. So WIC's prenatal care benefits reduce the rate of low birth weight births, meaning less than 5.5 pounds, by 25%, and very low birth weight births, less than 3 pounds and 5 ounces, by 44%. And then down here, it says that mothers who receive WIC's peer counselor support are 2 to 3 times more likely to breastfeed. And babies who are not breastfed spend more days in the hospital and require more prescription medication than breastfed infants. And mothers and fathers of breastfed infants typically need to take less leave from work to care for their sick children. So here are some more statistics about the importance of the WIC program. Next slide. Paid family leave. Access to paid leave is estimated to increase mothers' labor force participation by approximately 20% during the first year following the child's birth. States with paid family and medical leave versus unpaid or no leave reduce the chance of postpartum rehospitalization of the mother or the baby by 50%. Just 8% of workers in the bottom wage quartile, who on average earn less than $14 an hour, had access to paid leave in 2020. So only 8%. Next slide. Affordable childcare. For low-income children, every dollar invested in high-quality childcare can result in a $7.30 return with lifetime impacts for children. As they grow up healthier, do better in school, and earn more over the course of their lifetimes. The lack of access to affordable, high-quality childcare, especially for infants and toddlers, costs the United States economy $57 billion per year in lost earnings, productivity, and revenue. Prior to the pandemic, parents were losing roughly $30 billion to $35 billion in income each year because of the high cost of childcare, which led many of them, primarily mothers, to leave the paid labor force or reduce their paid work hours to care for their children. So that's a really big economic impact on our families, especially our low-income families and people in rural areas. Next slide. In all regions of the United States, the average cost of center-based childcare for an infant is more than the average amount that family spends on food and transportation combined. So you can see why this is also a hunger issue. In 29 states and the District of Columbia, infant care costs exceed the average cost of in-state college tuition at a public four-year institution. President Biden's American Families Plan will ensure that low and middle income families pay no more than 7% of their income for high quality childcare, saving the average family about $14,800 per year on childcare expenses. Next slide. The child tax credit of 2021. Ashley spoke about the child tax credit, and that's something that we highly support. And so families began receiving the child tax credit on July of 2015 of 2021. So just if you can think for a second, the question is, what do you think families are spending this money on? So go ahead and think about what you think families are spending on their child tax credit money on, because we have information and surveys and statistics about where this money is being spent. And Ashley says food. And so we're going to go on to the next slide for the answer. So Ashley is correct. It's food first, then utilities, then clothing, debt, savings, school supplies, rent, mortgage, vehicle payment, childcare, other, tuition, recreational goods, after school programs, transit, tutoring, and charity. So we can see that the child tax credit is actually an anti-hunger program and an anti-poverty program. Next slide. So the most important impact of the child tax credit of 2021 is that poverty among Black children would be cut by 52%, poverty among Latino children would be cut by 45%, poverty among Native American children would be cut by 62% nationally, poverty among white children would be cut by 39%, and poverty among Asian and Pacific Islander children would be cut by 37%. So this is really significant in terms of our fight to make sure that we are ending poverty. We saw the poverty statistics from the Census Bureau come out this week, and we are at about 11% poverty rate in the United States, which increased amid the pandemic. And so the big question is, next slide. What can you do? What is the call to action? Here in Arizona, we have Senator Mark Kelly and Senator Kyrsten Sinema, and they are really important voices when it comes to what happens not only in the state and in rural areas, but also across the country. And so we're calling on Senator Kelly and Senator Sinema to support the child tax credit expansion, but also the other programs that Ashley spoke about in her presentation. And so we are asking for you to consider doing the first step in advocacy. So what are those steps? We have 3 of them. If you can click the first one, Lily. So the first thing that you could do is you could write an email to your members of Congress. So if you go to bread.org/write, you can find resources to send one email to your 2 senators and your House representative. The second course of action, Lily, if you can click again, is to join a virtual office meeting. We have a meeting scheduled with Senator Sinema here this month, but we'll also be meeting with Senator Kelly and Senator Sinema again in the months of October and November. And so if you're interested in learning about what it is to be a part of an in-district meeting, a virtual office meeting, please let us know. We want you to be involved, and we want rural voices to be included in those meetings with us. And the last but not least, you could also call the U.S. Capitol switchboard, which is 800-822-7323, and call your U.S. Senator, Senator Sinema or Senator Kelly. Just pick up the phone, call the phone number, and say that you'd like to support the permanent expansion of the child tax credit, the 1,000 days infrastructure, and all of the programs that were mentioned by Ashley St. Thomas in this presentation. And so we want to make it easy, we want to make it effective, and we want your voice to matter when it comes to what's happening across the state and across the country. And with that, I'll pass it back over to Ashley.
Thanks, Lupe. Yeah, so there are a lot of ways to get involved if you're interested, and here's our contact information, our websites, and then every month we work with our partners at the Arizona Food Systems Network to put on an advocacy call specific to Arizona. The next call is October 1st, and the details for how to register are on the Food Systems Network website, which is there, azfsn.org. Those are at noon on Fridays. They're once a month when the Arizona legislature is not in session, and then when they return in January, we'll probably have them every other week. So there's plenty of ways to get involved. You can certainly reach out to me anytime, and if you are so inclined to call your members of Congress, we can always give you talking points too. They probably won't patch you straight through to the senator, but you can always leave a message with their staff. And that's all from me, Lily. I'll turn it over to you.
Okay, cool. Let me just stop sharing this. One sec. Okay. Thank you so much, Ashley and Lupe, for coming to speak with us today. We hope that food pantries get more involved in advocacy work. I think that is it for today. We will see you in our next training. Thank you too.
Thanks.